and today I will be performing bag technique. Its contents include paper lining, waste paper bag, plastic lining, apron, hand towel, soap in soap dish, digital thermometer, bandage and surgical scissors, disposable syringes, sterile dressing, cotton balls, micropore plaster, tape measure, surgical gloves, cord clamp, hot bag water, kidney basin, betadine solution, percent alcohol solution, ammonia solution, and hydrogen peroxide. For the assessment, first thing you need to do is to gather all equipments needed, such as the Chn Bag and its contents, as well as other paraphernalia, such as nurse's logbook, sphygmomanometer or BP apparatus, and stethoscope. Next is to identify and locate the client and explain the procedure. Good morning, ma'am! I am Cristina Marie Reina, student nurse from Southwestern University, Filma, and I am here today to perform bag technique for the home visit. Is it okay for you, ma'am?
Okay.
Thank you, ma'am. This is actually important in order for me to provide and assess your health needs as well as determine the family situation and perform nursing care treatment. So after introducing yourself to the client and explaining the procedure, observe the client and provide privacy. So in providing privacy, make sure to close all the curtains if there are any and make sure to close the door. Ma'am, would you like me to close the door for you?
Yes, please.
Thank you, ma'am. So providing privacy enables the client to have a sense of security and secured environment. Now for planning, first formulate your nursing objectives in the home visit. In planning for the home visit, make sure to consider and give priority for the assessment and recognize the individual needs and family. And lastly, the planning should be flexible. So for implementation upon arriving at the client's home, first thing you need to do is to look for a table or any flat surface and get the paper lining out of your Chn Bag. Make sure that the clean side is out and the folded part touching the table. Next, put the Chn Bag at the upper corner of the paper lining. And make sure to place the handles beneath the Chn Bag. Always make sure that the Chn Bag should be placed 6 feet away from the client to prevent the bag from any contamination. Then, ask for a basin of water or a glass of drinking water if tap water is not available. Place it outside the working area. This is to be used now for hand washing and to prevent the working area from being wet. Then, proceed to open the Chn Bag and get the plastic lining out. Make sure that the clean side is out and the folded part touching the table. This is to make a non-contaminated working field or working area. Then, you may take out your hand towel, soap dish, and apron in the bag. Then, close the bag. This is to prevent from any microorganisms that may contaminate the things inside the Chn Bag. Place it in one corner. And you may remove the plastic wrappers that covers the hand towel and apron. And then put it inside the Chn Bag. This is to be used now for hand washing. Now, you may start hand washing. Make sure to wipe and clean it with dry towel. Hand washing prevents microorganisms that may cause cross-contamination. After hand washing, pull the apron out of the working area, right side out, and the crease with wrong side touching the body. Slowly slide in your head in the neck straps and neatly tie the straps at the back. This is to protect the nurse's uniform and keeping the crease creates aesthetic appearance. Now, you may start putting out the things that are most needed for the specific case being visited, such as pregnant mother, newborn, postpartum mother, school-age child, or morbid case. They are your family caseloads. So examples include kidney basin, cotton balls, 70% alcohol solution, digital thermometer, stethoscope, and BB apparatus. Place them at one corner of your working area to make things readily accessible. Close the bag. This is to prevent from any microorganisms that may contaminate the Chn bag. After that, place the waste paper bag outside the working area to prevent from any contamination of the clean area. Then, you may now proceed in providing specific nursing care treatment to the client. It is very dependent on the health situation you are being visited. So, this is to maintain personal hygiene, provide comfort and security, and hasten recovery. So, assuming that I'm done with the procedure, I will now proceed with the aftercare. So, in aftercare, clean and sanitize the things that are being used with the use of 70% alcohol solution. So, clean them with the use of sterile technique, prevent from any infection. Place it inside the waste paper bag. Now, you may start hand washing again. Hand washing promotes clear provider and prevents spread of infection to others. Put them back into the Chn bag. So open the Chn bag and put all articles that are being used. This is to keep things organized. Then close the Chn bag. After that, remove the apron, folding away from your body. With soiled part, side folded inwards, clean side out. Fold it and place it inside the Chn bag. After removing the apron away, fold the plastic lining. Make sure that the clean side is out. Insert it in the Chn bag. Then, close the Chn bag to prevent prevent from any microorganisms that may contaminate the things inside the bag. Make post-visit conference on matters that are relevant to healthcare, taking anecdotal notes preparatory for final documenting. This is actually important in order to be used as reference for follow-up visit. Make an appointment either home or clinic and take note of the time, date, and purpose. This is vital for follow-up checkup or future visit. Now for next week, I will be back here for future visit. And the results I've gathered earlier will serve as a reference. So I will be back here at the same time as I arrived here in your house today. Thank you so much, ma'am, for your cooperation and for your time.
You're most welcome.
Next, get the Chn bag out of the table. And then fold the paper lining clean side out. Then, insert it in the flaps of your bag. And then close the bag. For evaluation and documentation, record all findings that are relevant to the client and family members. Take note of environmental factors which affects the client and the family health. Include quality of nurse-patient relationship. Assess the nursing care provided and its effectiveness.